This week in Harrisburg marks the beginning of budget hearings for the Pennsylvania Department of Human Services. And one of the big topics in the DHS budget is funding for crisis pregnancy centers. Joining us live to tell us more about the centers and what the funding could be like in this year's budget is Erie News Now State Capitol correspondent Brendan Scanlon. Good evening, Brendan.
Hey there, Mike. Good evening. Opponents to these centers say that they work to dissuade abortions intentionally. Proponents say they simply work to provide a real alternative. Now, today we heard why advocates for abortion access say that they want to reduce state funding for these centers and why some pro-life lawmakers disagree.
Crisis pregnancy centers are anti-abortion organizations that seek to target low-income people experiencing unintended pregnancies to prevent their access to contraception and abortion.
Tara Murtha with the Women's Law Project says the Commonwealth needs to stop funding the centers, especially with federal dollars meant for low-income families.
It's a poor investment of funds to use public dollars to fund a crisis pregnancy center scheme that disseminates widespread false medical claims and functions as a barrier to legitimate health care.
According to Equity Forward, Pennsylvania is one of 7 states that provides state and federal temporary assistance for needy family or TANF dollars to the centers. Some Democrats also expressed concern with how the centers operate.
They're literally experimenting on women. So we're very concerned about that.
But Republicans like Representative Kathy Rapp say the centers play an important role in offering support for those who are voluntarily considering alternatives like adoption.
Not only do they provide support for the mother up into the birth of the child, but they also provide services after the child is born.
Rapp says state funding for the centers resulted from compromise to allow funding for Planned Parenthood nearly 3 decades ago.
If we are going to fund Planned Parenthood, then we would also fund the real alternatives for women who seek to keep their baby, put their baby up for adoption.
And Mike, since the 1990s, the Department of Human Services has been required by law to provide funding for these centers. In their budget proposal for the upcoming fiscal year, there is over $6.2 million in state appropriations and another $1 million federal dollars, again, for those centers. For now, reporting live at the state capitol in Harrisburg for Erie News Now, I'm Brendan Scanlon. Mike, back to you.
Brendan, thanks.